ስለ ኤግዚት ኤግዛም ኦር COC ኤግዛም ለነርሲንግ አንዳንድ ጥያቄዎችን እንሰራለን ማለት ነው። ጥያቄው ወደ 50 ጥያቄው ነው፣ ግን በፓርት 2 እናያለን ማለት ነው። ዛሬ እስከ 30 ጥያቄ ማየት እንችላለን ማለት ነው። ጥያቄው በጣም ቤስት ጥያቄ ነው። መልሱም አለው፣ ዲስክሪፕሽንም አለው። ለጓደኞቻችሁ ደግሞ ሼር ማድረግ ግዴታ ነው። So we will start today exit exams or COC exam for nursing students. We will see 30 questions, around 30 questions, but the exams, the prepared exams around 50 questions we will see in part 2. In under part 1 we will see only 30 questions. Question number 1 says that a nurse working in district with a total population of 45,000, total population 45,000 in area. There was an acute epidemic of acute water diarrhea that lasts for 3 consecutive weeks. The nurse observed 26 cases in first week. So the test done in first week, they say 26 cases and 10 cases in So in second case or in second weeks, 10 cases in the second week is recorded and 5 cases in third week were recorded and 4 days over the 3 weeks. Calculate the attack rates of AWD, acute water diarrhea, over the 3 weeks. This means the total cases, the total attack rate should be calculated. So how we calculate the total case? A, on option A, the questions are said. On option A, 89 AWD cases per 100,000 people at risk. B, 911 AWD cases per 100,000 people at risk. C, 587 AWD cases per 100,000 people at risk. D, 33 AWD cases per this number. So the questions asked the total attack rate in 3 consecutive weeks. In first week 26, in second week 10, in third week 5 cases are recorded. So the total calculation for this question is answer. The total calculate the attack rates of acute water diarrhea or AWD over the 3 week or total week. You can calculate by using these formulas. Formula attack rates equal to number of cases or recorded case divided by total population at risk multiplied by multiplier. It is nothing that the multiplications of 100% of this rate. So in this case, multiplier is equal to 100,000 divided by total population at risk. The total population at risk given for this question is 45,000. 45,000 is given 45,000. So we calculate each case at week, then add all 3 weeks. In first case or first week, 26 cases are achieved, and the formula for multiplier is 10,000, 100,000 divided by 45,000. This one is total population at risk, the formula. So the attack rate for the first week is 26 is the attacked case in first week divided by total population at risk multiplied by multipliers. This formula, this one is means this. So after calculation, it is equal to a result in first week. Then second week for the second week. This one is not the first, the second. The second week equal to 10 cases recorded. Similar with this was calculated by in this one for the second week. Second week equal to 10 over 45,000 times 100,000 over 45,000. It is equal to some numbers is recorded in here. You can finish it. Then on third week, this one also third time period. Third week it is recorded 5 cases recorded. Similarly with that, this one also third. 5 over 45,000 times 100,000 over 45,000. The result is achieved. You can calculate, you can finish it. So now add up attack rate for each 3 weeks. First week plus second week plus third week to get the overall attack rate. That means the overall or total attack rate equal to attack rate on the first week, what you calculate, plus attack rate in the second week, what you get, and plus third rate in third case. So the total result is after calculations you get 911 acute water diarrhea cases per 100,000 people risks. So the best answer for this question is option B is the best answer. Option B is the best answer for the questions. So the answer is option B. You can easily calculate it. Those please finish first case, second and third case calculations up to the ends. Question number two. A 37 years old female patient was admitted in surgical ward with head injuries following an activities. On a physical examination, the patient was drowsy, rested, irritable, and discomforted. She had difficulty to follow commands, no response for painful stimuli, and abnormal perceived. She had a wide posture usually, and hyperthermia and raised blood pressures. What is the most likely nurse diagnosis for this patient? A. Result for enhanced knowledge of risk factors. B. Decreased intracranial adaptive capacities. C. Ineffective breathing pattern. D. Disturbed body image. So the best answer for this question is decreasing intracranial adaptive capacity should be done by this nursing based on the pain of these females. So the nurse should be support this patient by decreasing the intracranial adaptive capacity. We will see the descriptions. Based on the provided information or the given informations of this patient from third parties, from third parties. The most likely nursing diagnosis for this patient is decreasing the cranial adaptive capacities. The patient presents with a sign and symptoms of a head injury, including drowsiness, restlessness, irritability, and difficulty following commands. This clinical manifestation suggests a patient decrease in cranial adaptive capacities, indicating the brain inabilities to respond effectively to change in cranial environments. Other options: option A, restless for enhanced knowledge of risk factors; C, ineffective breathing pattern; D, disturbed body image. Do not align with primary concerns associated with head injuries and altered neurological status. So, option B is the best answer for this question. Third question. Question number 3 says that a 29 years old female patient comes to adult or adult OPD with complaints of nuchal rigidities, vomiting, and seizure. The physical examination's finding indicated a positive kerning sign and person switch sign, and the patient spread over the bodies. Laboratory findings show that CSF appears cloudy, decreasing the glucose concentrations, elevated protein level, and elevated WBC and RBC counts. What is the most likely medical diagnosis for this patient? A. Option A. Meningococcal encephalitis. B. Meningococcal meningitis. C. Viral meningitis. D. Viral encephalitis. So the answer is B. Meningococcal meningitis. Based on the presented symptoms and the laboratory findings, the most likely medical diagnosis for this patient is A. B. Meningococcal meningitis. The patient's symptoms including nuchal rigidity, vomiting, seizures, positive kerning signs, and breathing sign, along with the clearity appearance of the cerebrospinal fluid. Decreased glucose concentrations, elevated protein levels, and elevated white blood cells and red blood cells count in CSF are indicative of bacteria meningitis. The meningococcal meningitis is a serious bacteria infections caused by initial meningitis. So it is a type of bacteria. And it can present with the mentioned clinical features. Option A, C, and D are less likely based on the combinations of symptoms and laboratory findings described, as they point more toward the bacteria etiology rather than viral ones. So the left one is talked about the viral disease. So based on sign of this patient, we could be analyzed. These diseases are typical bacterial diseases from bacteria. These type of bacteria are occurred in this people, persons or patients. Tomorrow. So those options are relating to bacterial disease, viral diseases. So the best answer is should be bacterial disease from bacterial disease. Yes, meningococcus typing. Next questions. Question number 4. Question number 4 said that a 39-year-old female patient was admitted to a medical ward with complaints of fevers and vomiting for 3 days. On physical examinations, the patient had nuchal rigidity, positive Kerning sign, dry mucous membranes, and small petechial over upper torso and abdomen. Patient's temperature was 40 degrees after the first 2 hours of cases. Patient levels of causing decreases. What priority nursing action should be taken for these patients? Priority nursing actions. A. Providing sponge bath if temperature continue to rise, which means mechanism of decreasing temperatures. B. Measure and compare intake and output every 2 hours. C. Perform neurological assessments over 2 to 4 hours. D. Administer prescribed intravenous antibodies. So the best answer for this question is option D. Option D. Administer prescribed intravenous antibiotics should be taken for these patients. We will see this description. Option D. Based on the provided information and the given information, the urgency of situations, the priority nursing action for this patient is A. D. Administer prescribed intravenous antibiotics. The patient is presenting with signs and symptoms consistent with bacterial meningitis, including fever, these types of bacteria, vomiting, nuchal rigidity, positive necking sign, dry mucous membrane, and petechial rash. The rapid deteriorations in the patient conditions with elevated temperatures and decreasing the levels of consequences suggest the need for immediate interventions. So administering prescribed intravenous antibiotics prompts is crucial in the management of bacterial meningitis to address the underlying infections and prevent further complications. Option A. Provide sponge baths for if the temperature continues to rise. Option B. Measure and compare intake and output every 2 to 4 hours. C. Every 2 hours. C. Perform the neurological assessments over 2 to 4 hours are important aspects of nursing care, but those are important but may not address the immediate life-threatening conditions required antibiotic intervention should be taken for these persons. Those are also the ways or the mechanism of helping these patients, but immediately for saving the life of this person, the nurse should be doing antibiotic intervention. Next question number 5. A 35-year-old female patient comes to the hospital with complaints of recurrent bronchial asthma. The patient angrily asked the nurses why it is become recurrent. What is the most appropriate answer for patient concern? A. Intolerance of medication. B. Poor medication adherence. C. Low potency of medications. D. Difficult to avoiding the triggering agents. So the answer is D. The most appropriate answer for the patient concerned about the recurrence of bronchial asthma is difficult to avoiding triggering agents. Recurrent bronchial asthma can often be influenced by exposures to triggering agents or environmental factors that exacerbate asthma symptoms. These triggering can include allergens, irritant infections, and other environmental factors. It is important for individuals with asthma to identify and minimize exposures to those triggers as a part of their asthma management. Option A, B, and C focus more on medication-related issues, while option D addresses the patient potential environmental factors that can contribute to recurrence of asthma symptoms. Understanding and avoiding tragedy against agent is the key component of asthma management. Question number 6. A 40 years old HIV positive woman came to art clinic with complaint of intense itching on physical examinations. The patient had filled papilla with variable stages of development on her trunk and faces. What is the most likely examination for this finding? A. Cellulitis. B. Prurigon. C. Herpes simplex. D. Molluscum contagiosum. The best answer is option D. The most likely explanations for the finding of firm papules with variable stage of development in an HIV positive woman with intense itching is this. Option D is the best answer. Molluscum contagiosum is a viral skin infection. It's one type of viral skin infection caused by the Molluscum contagiosum virus or MCV virus. MCG virus contains present as firm dome-shaped papilla with central depression. In individuals with comparable immune systems, such as those with HIV contagions, can be more widespread and persistent. Option A, B, and C are less likely explanations for the described skin finding. Cellulitis is usually associated with redness, warmth, and swelling. Those with itching, nodules, and herpes simplex typically manifests as painful vesicle. The described papules with central dimpling are more characteristic of muscular congenitals. So the answer is option B is the best answer. Next question number 7. A 27 years old male patient was linked to art clinic to start heart from TB clinic. Means HAA arts from TB clinic. The patient was on antibiotic treatments and his CD4 count is 500 cells per millimeter cube. What is the most preferred drug? Which means types of drug regime for these patients. Based on those diseases, what we should be take for this patients? A. TDF plus 3TC plus EF5 V. B. AZT plus 3TC plus EFV. C. TDF plus 3TC plus NVP. Option D. TDF plus 3TC plus DTG. So the answer for this question is option C. For this patient, we should be give TDF plus 3TC plus NVP because the most preferred drug regime for 27 years old female patients with CD4 accounts 5,500 cell per millimeter cube and linked to ART means antiretroviral therapy. And clinic from TB clinics is option C. Should be given for this. The choice of antiretroviral therapy is guided by various factors including CD4 count, coexisting conditions such as TBs, and potential side effect. In this case, TDF, 3TC, and NVP form a suitable and commonly used combinations for HIV treatments. We'll see next question number 8. So this one is the definition. Question number 8 said that a 34 years old male patient came to an clinic with a purulent discharge in the right ear after foreign body removed 2 months ago. The nurse examined his middle ear use otoscopy to assess the conditions of thymic membrane. What could be the most likely assessment findings of this patient? A. Radiant inflammation. B. Perforations and cholesterol. C. Appear dull and has air bubbles. D. Pearly gray and bulky to outside. So the best answer is B. Perforation and cholesterol. Descriptions of this one is given the patient's histories of foreign body removed 2 months ago and current complaints of purulent discharge in the right ear, the most likely assessment finding would be perforations and cholesteatomas. Cholesteatoma is being but potentially destructive growth of skin cell in the middle ear behind the eardrums. When a foreign body is removed, it can create an opening in the tympanic membrane. This opening may predispose the patient to infections and development of cholesteatoma. So the answer to this question is the best options. Next question number 9. ቀጣዩ ጥያቄ number 9. A 30 years old man underwent middle ear surgery for the management of chronic otitis media. After surgery, the deity nurse prepared teaching plan about the postoperative instructions for the patient. What is the most appropriate instructions the nurse should be developed? A. Avoid physical exercise 2 to 3 weeks after surgery. B. Tinnitus sensations in normal up to 5 weeks after surgery. C. Take soft and non-retained meals 1 to 4 weeks after surgery. D. Sneeze and couch with enough with mouth open 2 to 3 weeks after surgery. The answer is D. Sneeze and cough with mouth open 2 to 3 weeks after surgery. Should be advised these persons. Sneeze and coughing with mouth open 2 to 3 weeks after surgery. The most appropriate instruction for the patient who underwent middle ear surgery, especially for the management of chronic otitis media, it is to instruct them to sneeze and cough with mouth open 2 to 3 weeks after surgery, because sneezing and coughing with mouth closed can increase the pressure in the middle ear, potentially affecting the healing stages. The surgery involves manipulation of the structure with middle ear and sudden increase in pressure, as with closed mouth, sneeze or coughing could be detrimental to the surgical outcomes. By advising the patient to sneeze and cough with mouth open, the nurse is helping to minimize the risk of complications and promote prompt healing. Option B, C, and D, A, B, A, and C are not necessarily related to the specific postoma. So that D is the best answer to this question. Question number 10. A chronic male alcohol patient was admitted to medical ward with end-stage liver cirrhosis. The patient had stage 1 hepatic encephalopathy, had expelled epistaxis and spider angioma. A nurse prepared a care plan and give patient-centered care. What is the most appropriate nursing care that should be given for this patient? A. Administer the supplementary vitamin K. B. Assess and select of desired exercise. C. Keep patient fingernail short and smooth. D. Provide diet high in carbohydrates and proteins. The best answer is option C. Keep patient fingernail short and smooth is the best mechanism. Given scenario describes a patient with end stage liver cirrhosis, stage 1 hepatic encephalopathy, unexplained P6 or nosebleed, and spider angioma. The most appropriate nurse care in this context could be to keep the patient fingernail short and smooth. The patient with liver disease are at an increased risk of bleeding due to the empirical factor synthesis by the liver. Unexplained epithesis or niacin can be associated with these bleeding tendencies. Keeping the patient fingernail short and smooth is important to prevent accidental self-inflicted injury from scratching, which could lead to bleeding. So the answer is C. Question number 11. Nurse prepared patient for surgery by inside energy tubes. After inserting the tube, the nurse confirmed whatever the tube is in the stomach. What is the most appropriate sign used for confirmation? A. The color of litmus paper is not changed after GI aspirations was applied. B. There is no air bubble from the tip of energy tubes in the cup of water. C. There is no nasally sound accumulated over abdomen. D. There is no central cyanosis and shortness of breath. There, B is the best answer for this question. There is no air bubble from the top of the energy tube in a cup of water. The most appropriate sign used for confirmation of energy tube placement in the stomach is the absence of air bubble from the tip of the energy tube in the cup of water. When the energy tube is correctly placed in the stomach, no air bubble should be observed, or the tip of the tube is submerged in water. This mechanism or method is known as water seal test. I think you should be deeply reading about the water seal test mechanism and is really why to confirm the placement of the tube in the stomach. Option A. Color of litmus paper not change after gastrostomy. GIG aspiration is not commonly used method for energy tube placement confirmation. C and D are unrelated specific techniques of verifying this placement. Question number 12. A 54-year-old female male patient came to an emergency department with left leg femoral bone fracture due to the falling accident, and he was admitted to orthopedic ward for after surgery. The patient histories indicate that he used cigarette and excess alcohol for 40 years. The assessment findings showed that the patient's lung sound diminished. Nurse realized that the patient is to get greater risk for cerebrovascular accidents. What additional assessment finding is most likely relevant for this patient? Additional assessment. A. Ask the patient family histories of cerebrovascular accident. B. Check patient chart for histories of valvular disease. C. Check the patient charts for histories of encephalitis. D. Check the patient charts for histories of brain injury. Option B is the best answer. Option B. Check the patient clarity for histories of vascular disease. Another diseases are found in here in these patients. So it is necessary to check this disease. Deep learning. Given patient history of smoking and excess alcohol use for 40 years, ambiguous assessment findings of diminishing lung. The lung of these persons are destroyed. There is a concern for the patient overall cardiovascular health. The nurse is considering the patient increased risk for cardiovascular accidents, also known as a stroke. The most relevant additional assessment finding for this patient could be to check the patient charts for histories of valvular heart disease. Option B. Option B. Read another descriptions of this one. The others are not related to this. Options. Question number 13. Question number 13. A 29 years old male patient come to a medical OPD with complaints of vomiting, nuclear rigidities, and severe headache of 2 days durations. Assessment finding indicates that the patient was positive for Brody disc and negative sign. He had photophobia and facial purchase. What is the most likely nursing diagnosis for this patient? A. Risk for ineffective airway clearing. B. Risk for ineffective breathing pattern. C. Risk for impaired gas exchanging. D. Risk for caregiver role strains. The answer is option A, risk for ineffective airway clearance. The description of this answer is the symptom described in the scenario: vomiting, nuclear, several ditch, and caning, potassium in the C1s, and facial patching are indicative of potential meningitis. Meningitis is an inflammation of meninges and membrane coverage of the brain and spinal cords. Given the severities of symptoms, particularly the involvement of the central neuron system, there is a risk for ineffective airway clearance. Meningitis can lead to increased intracranial pressure, altered mental status, and compromised neurological functions, why an effective patient inability to protect airways. The risk for the ineffective and airway clearance is especially related to. So, question 1-4. A 29 years old male patient come to emergency room with complaints of the abdomen and plain lateral. On the patient was more localized to right lower quadrant with nausea and vomiting. Then surgeon made diagnosis of appendicitis and scheduled for surgeries. What is the most likely surgical complications that may be happen in this patient? A. Dehydration, septicemia, fever, bleeding, abdominal abscess. So the answer is abdominal abscess. We will see this descriptions. Appendicity is an inflammation of the appendix, and surgical removal is standard treatment during the surgery. If the appendicity has ruptured or there is a comminution of the abnormal cavities with bacteria, there is a risk of developing abdominal abscesses. An abdominal abscess is localized collections of fluids within the abdomen, and it can be led respiratory. So, question number 14. A 23-year-old female patient came to an emergency department with the complication of the low-grade fever and epigastric pain progress to right lower quadrant. On abdominal examinations, the nurse identified local tenderness and positive rhizosign. What is the most able to priority nursing interventions for this patient? Perform frequent palpations of abdomen. B. Administer analogous medications. C. Administer laxative or enema. D. Maintaining negative to patients. The answer is D. This criminal presentation is suggested of possible appendicitis. The roving sign refers to a pain in the right lower quadrant when the pressure is applied to the left lower quadrant, meaning QB potency is important to decreasing the stomach acids. It helps in keeping the stomach empty and reduce the risks of aspirations during surgeries. Administering analgesic with caution may be considered to manage pain, but maintaining negative patterns takes precedence in these situations. Frequent palpations of abdomen may aggravate the conditions, and laxativities or enemas are not typical indications of appendixes. So the answer is option D is the best answer for these questions. Next question. Question number 6. A 24-year-old patient came to the hospital with the complaints of the anorexia, heartburn, after eating, nausea and vomiting. After thorough assessment and physical examinations, the nurse diagnosed that patient had autoimmune chronic gastritis. Which additional manifestations lead to the neurose of the conclusions? A. Anemia. B. Dehydration. C. Epigastric pain. D. Blood vomiting. A. This sign is sign of anemia. Sign of anemia. We will see these descriptions. Autoimmune chronic gastritis can lead to the destruction of the parietal cells in the stomach, which are responsible for the producing the intrinsic factors. Intrinsic factor is crucial for the absorption of vitamin B12 in the small intestine. When there is deficiency of intrinsic factors, it can result in vitamin B12 deficiency anemia. The lack of vitamin B12 is anemia, known as prestige anemia. This type of anemia is often associated with autoimmune chronic gastric. Autoimmune chronic gastric. These types of gastric is anemia type. Therefore, the presence of anemia in this patient is the key manifestation that suggests autoimmune chronic gastric as the underlying cause of the gastrointestinal systems, such as anorexic heartburn after eating news and vomiting. Other options: dehydration, epigastric pain, blood vomiting are not typically associated with autoimmune chronic. Question number 17. A 67-year-old male patient come to adult OPD with complaints of abdominal pain, sensation of incomplete impeding, and rambling of 1 month durations. He was taking narcotic drug, antacid with ammonium preparations and low amounts of fluid and fever. The nurse prepared to administer closing enema. What is the most likely condition? Indications to decide this procedure: A. Psychogenic disorder, B. Neurologic disorder, C. Orthopedic disorder, D. Chronic disorder. The answer is chronic constipation. Chronic constipation, especially when associated with symptoms such as abdominal pain, incomplete impeding, and altering bowel habit, may be warranted of cleansing anemia. So the best answer is option D, based on the given information. These are the other options. Option A to C are not typically indications for administering the cleansing anemia. However, through assessment by healthcare providers is crucial to determine the specific cause of the symptom and whether anemia is an appropriate intervention for the patient conditions. So the best answer is option D. And classification is ጥያቄ number 18. 18ኛው ጥያቄ ደግሞ እንደዚህ ይላል. A nurse was taking care of 34 years old woman who was diagnosed with acute gastritis secondary to stress. The nurse prepared a nursing care plan of patient outcome after interventions. What is the most appropriate patient outcome predictions by nursing? A. Report feeding less antacid. B. Eat schedule meals regularly. C. Take medications as prescribed. D. Avoid irritating food and beveraging. So the answer is option B. The patient will report a reduction in stress level and demonstrate provide coping mechanisms. In case of acute gastric secondary to stress, managing Stress is a crucial aspect of care. Stress reduction can contribute to the resolution or prevention of gastric symptoms. Therefore, the patient outcome focuses on reducing stress level and improving the coping mechanisms, aligning with a holistic approach to address the reality cause of the conditions. It is important to note that nursing care plan should be individualized based on patient's specific need and circumstances. Collaborating goal setting with patient ensures that outcomes are meaningful and achievable for the individual. So the best answer is option B. Next question number 19. A mother who has been lactating for 6 months come to family planning clinic upon return of menstrual periods. The nurse discussed about the contraception option, their side effects and benefits with the mother, and she preferred the injectable method of contraception. What is the appropriate site of administration of contraception? The choose A. Ventrogluteal muscles. D. Deltoid muscles. C. Gluteal muscles. D. Pectoral muscles. The answer is gluteal muscles. Option D. C. The answer is C. Etopo-provera is a typical administration intramuscularly into the gluteal muscles. This site is preferred because it is allowed for slow and sustained absorption of contraceptive medications, providing protection against the pregnancy for the period of 3 months. Ventrogluteal muscles is also an acceptable site for administrations and HSK is providing administration. Healthcare providers may choose one locations based on the patient preference and accessibilities. The deltoid muscles and the pectoral muscles are not commonly used site for administration. So the answer is option C is the best answer for this question. Next question number 20. ቀጣው ጥያቄ ቁጥር 20. A postpartum woman come to clinic seeking for non-hormonal and long-acting contraceptive as she does not need more children. Let's explain about the benefits and side effects of the contraceptive method requested and planned to provide a service for the woman. What is the most appropriate time to provide this contraceptive after delivery? A. 45 days. B. 48 hours. C. 6 months. D. 9 months. The answer is for 6 months. Description of these questions. Typically, healthcare provider recommended waiting until 6 weeks postpartum for the comprehensive visit, which including the assessments of the woman health and discuss about family planning. After this visit, non-hormonal and long-acting contraceptive method such as IUDs can be initiated. Providing the contraception at 6 months mark allow for the women bodies to recover from childbirth and for the healthcare provider to assess her overall healthcare before recommending suitable contraceptive method. It is important for the healthcare provider to discuss contraceptive options, including their benefit and side effects of this disease. So the answer is C, the best answer. Question number 21. A woman who has been using UICD for 6 months come to a clinic with complaints of lower abdominal with pain during the sexual intercourses. On a vaginal examination, and cervix tenderness was identified. What is the appropriate nursing diagnosis for this woman? A. Risk for injury. B. Risk for infection. C. Risk for bleeding. D. Risk for training. The answer is risk infection. Infection ነው እንጂ ሌላ ነገር ኤግዛም ማድረግ አንችልም በዚህ ሰዓት። So the descriptions of this question is given like here. You can read this one detailing. We will see on part 4 of these examinations on part 2 ላይ ደግሞ ድጋሚ ተገናኝተን ዲስከስ እናደርጋለን ማለት ነው። ዛሬ ጥያቄዎች ከ1 እስከ 21 አይተናል። የቀረው ጥያቄዎች ደግሞ ፓርት 2 ላይ ፕሬዘንት ማድረግ ይቻላል ማለት ነው። ለዛሬ እዚህ ላይ በቀናል። Thank you for your watching. Please share for your friends and subscribe my channel. ለቀጣዩ ጥያቄ ደግሞ ምልሲት አፈናስታይ ጋፊ አፋኒፍ ወላርኪና አራካ ጋፊ tokko gadi gidami tokko waliin hojjenneerra hiriyoota keessaniif share godha, subscribe gochuun dagatina, comments godha. Gaaffilee biroo yoo barbaadan commentii naaf barreessuun dagatina. Galatoomaan isin jechuu barbaada. YouTube channel keenya subscribe godha. Galatoomaa. Bye.